So the temporary suspension of USAID funding to countries and organizations around the world has had a ripple effect on a number of healthcare facilities in South Africa. This follows an executive order issued by US President Donald Trump on January the 20th for a 90-day pause on all disbursements of foreign aid pending further review. Well, in South Africa, some institutions, especially those focusing on HIV treatment rollouts, have temporarily closed their doors to patients following the directive, and the long-term consequences could be dire. Our reporter, Latashia Naidoo, filed this report.
In the days following US President Donald Trump's executive order authorizing the halting of all US aid, the fallout for healthcare services reliant on American government funding has been detrimental. The sudden halt of funding has resulted in the suspension of critical health support services in certain communities, with a number of NGO-led facilities temporarily shutting their doors following the stop work order that was issued with immediate effect. Key populations have been affected, particularly members of the LGBTQI community and those seeking antiretroviral and hormone replacement therapies, which are funded through the US President's Emergency Plan for AIDS Relief, or PEPFAR program. South Africa has been a major recipient of PEPFAR since 2004.
This particular decision can potentially take us back in the fight against HIV. We know that transgender women especially is disproportionately impacted by the HIV pandemic, and so again it will be disproportionately impacted by this particular decision. I think when we are looking at the halting of US foreign aid in conjunction with the executive order recognizing only two sexes and of course erasing trans and gender diverse persons, we are more concerned about what this 90 days will entail.
The burden of care will now temporarily fall on clinics and organizations like the Triangle Project, which will facilitate the rollout and disbursement of vital life-saving ARV, HRT and PrEP medication to communities directly affected by this directive. Trump's instruction has also put the jobs of healthcare service providers in jeopardy. But it's not just HIV prevention programs that have been affected by the injunction.
We've always been about helping people to access the treatment that they need, and meaning, HIV treatment, prevention of HIV treatment, but also hormone replacement treatment. So not only has this affected us, it's affected many people. Many people were stopped from working the day that they were told that they needed to stop. And that's people that, are no longer now earning a salary or a stipend. It's affected us terribly with our healthcare workers that provide the services in the community to people living with HIV. They have been stopped as well.
The Western Cape Health MEC has given her assurance that despite the funding shortfalls, contingency measures are being put into place to allow affected communities to access their medications.
The Western Cape government has been made aware of stop work orders issued to various support partners funded by the US State Department. This is a developing issue, and we're working closely with our delivery partners to assess the situation and minimize any disruptions. While the way some services are delivered may change, essential healthcare, including the procurement and distribution of medications such as ARTs, will continue.
Around 5.9 million South Africans access HIV treatments through programs largely funded by the National Health Department, with PEPFAR contributing 17% of that funding. But despite calls on the US government to rethink its strategy and lift the funding suspension, there's been no clear indication as to if or when Washington will provide answers about the continuation of its foreign aid services. For Newzroom Afrika on Channel 405, I'm Latashia Naidoo in Cape Town.